I give dialysis centers and transplant centers a lot of grief, and rightfully so, because of like poor business practices, the way they treat patients. How one individual can change the fate of all these different patients. But it's always important to remember that as difficult as dialysis centers and transplant centers can be to deal with sometimes, patients have to take some responsibility. Like, patients have to do their due diligence to make sure that they get where they need to go. Like, with dialysis, for example, like, it's on you as the patient to make sure that you're not fluid overload regularly, because fluid overload will happen. It's happened to me, it's happened to other patients, it will happen. But it's always important to be cognitive of not allowing that to happen often enough where it now affects your health and you're going to the hospital and things like that. Being proactive in your labs, if you're cognitive enough to do that. Making sure that your potassium is within range, making sure your phosphorus is within range, making sure that you follow the instructions of both the transplant center and your dialysis center. Like, for example, if you want a transplant, then you gotta do the work. You gotta put the work in order to get to that point. So if your issue is like a dietary issue, maybe consider some dietary changes. It doesn't have to be all in one day. Maybe just make small incremental changes until you get to where you want to be. Like if you're having issues with phosphorus or potassium, maybe, and this is kind of what I did, I would get the labs, I would see what the potassium and the phosphorus is, because those are like the two big ones that transplant centers and dialysis centers really want you to stay on top of, are those two things, phosphorus and potassium. But what I would do is I would get the labs, I would look at both of those lab results, and then I would make dietary changes according to those results. So I would think back to all the things that I was eating. So if I were eating too many bananas or too many nuts or things like too many greens, I would try to cut back on those things or try to find like a medium ground. So that way my labs would be in check. Now, you don't gotta go crazy with it, but you always want to make sure that you are doing what you need to do to get to where you want to go. If transplant is what you want, then you need to work towards that. And everything you do when you're on dialysis needs to reflect, oh, I want this transplant. So talk to your care team at your dialysis center. What do I got to do in order to get this transplant? And I need to start making steps to do that. That's what I did. I didn't want to stay on dialysis forever. I didn't want to be one of those patients. So I knew I wanted this, and I communicated not with the dialysis center, because for the most part, like, they don't really care whether you get a transplant or not. They don't. Like, if you die in your home and you don't come to transplant, it's no big deal. They'll fill your seat up with the next patient coming in, or and they won't even, in like a week or two, they ain't even gonna remember your name. But you do have a nephrologist while you're at the dialysis center. Talk to your nephrologist, talk to your social worker, talk to individuals who are not on the floor with you doing your dialysis, because they'll give you a more straightforward, clear-cut line of what you need to do in order to get the transplant. And once you get the transplant, talk to your transplant care team. They are more open with you then after you get the transplant than they would be before you got it. Right? So your care team with transplant after post-transplant is more accommodating and more open to speaking to you about what you need to do in order to keep the kidney up and running. So I go to labs once a week, every week, for I don't even know, the foreseeable future. And I look at those lab results. I don't just do the labs and just move on. I try to do my due diligence. I look at those labs every time the results come in every week. And I look at the phosphorus and the potassium and the creatinine, and the function of the kidney to eliminate waste in my body. Those are the three things I'm always looking for. And if one of those things is drastically elevated or drastically decreasing, then I call my care team and I talk to them. And I ask them, hey, listen, is this a result of a medication I'm taking? Like, what do I got to do to get these labs right so that way I can have this kidney for a long time? I've worked so hard to get it, and I don't want to lose the transplant just because, like, I'm being lazy. Or I prioritize wanting to go back to doing the things that I did before over making those slight adjustments and changes to keep the kidney and live a better lifestyle. A lot of it comes down to discipline, because transplant centers and dialysis centers, they're not going to hold your hand. They're going to make suggestions and they're going to tell you what you need to do, but doing those tasks is entirely up to you.